Top 10 Worst Vegetables Diabetics Must Avoid at All Cost. Vegetables are often regarded as the cornerstone of a healthy diet due to their rich nutritional content and essential role in overall well-being. For individuals managing diabetes, however, the relationship with vegetables isn't as straightforward as it seems. While many vegetables are low in carbohydrates and packed with vitamins, some can inadvertently raise blood sugar levels or even exacerbate insulin resistance. This is particularly concerning for diabetics who must carefully monitor their carbohydrate intake and glycemic response to maintain stable glucose levels. The goal isn't to vilify these vegetables, but to understand their impact and make informed choices. By learning which vegetables are less diabetes-friendly and discovering suitable alternatives, diabetics can better navigate their diets and enjoy meals without compromising their health. Let's begin with one vegetable that often surprises people with its potential to spike blood sugar: butternut squash. 1. Butternut squash. Butternut squash is often celebrated for its creamy texture, subtle sweetness, and rich nutrient profile. It is packed with essential vitamins like vitamin A, potassium, and fiber, which are generally considered beneficial for overall health. However, for diabetics, the story is more complex. Butternut squash has a relatively high carbohydrate content compared to other vegetables, which can interfere with the body's ability to maintain stable blood sugar levels. A single serving of butternut squash contains enough carbohydrates to potentially cause a rapid spike in glucose, especially for individuals already struggling with diabetes management. The problem lies in how quickly the body digests the carbohydrates in butternut squash, converting them into sugar and releasing it into the bloodstream. This rapid digestion can lead to blood sugar fluctuations, which are not only inconvenient, but can also be harmful over time. According to research and guidelines from the American Diabetes Association, managing carbohydrate intake is critical for maintaining glycemic control and avoiding complications like neuropathy, cardiovascular disease, and vision problems. To incorporate the nutritional benefits of butternut squash without compromising blood sugar stability, diabetics might consider significantly limiting their portion sizes or pairing it with low glycemic foods like leafy greens or lean proteins. For those looking for even safer alternatives, vegetables such as broccoli, cauliflower, or spinach offer fiber, vitamins, and minerals without the risk of glucose spikes. These substitutes also provide the satiety and texture that butternut squash offers, making it easier to transition away from higher carb options. Ultimately, while butternut squash can still fit into a diabetic-friendly diet on occasion, it requires careful portion control and mindful meal planning. For those seeking to stabilize their blood sugar levels, reducing or replacing butternut squash with lower carb alternatives can be a small but impactful step toward better diabetes management. 2. Corn. Corn is a staple ingredient in many diets around the world, known for its versatility and satisfying sweetness. However, for individuals managing diabetes, corn presents unique challenges due to its high carbohydrate content and glycemic impact. A single cup of corn contains approximately 21 grams of carbohydrates, with minimal fiber to moderate its effect on blood sugar levels. This combination can lead to sharp glucose spikes, making it a risky choice for those with diabetes or insulin resistance. Corn's glycemic properties stem from its natural sugars and starches, which are quickly digested and absorbed into the bloodstream. Additionally, processed corn products, such as corn syrup, corn chips, and cornflakes, are even more detrimental due to added sugars and unhealthy fats. These processed forms of corn not only exacerbate blood sugar fluctuations, but also contribute to other health issues, such as weight gain and increased cardiovascular risk. For diabetics who enjoy corn, moderation is key. Consuming small portions and pairing corn with high fiber, low glycemic foods can help mitigate its effects. For example, combining corn with a lean protein source like grilled chicken or pairing it with non-starchy vegetables such as spinach or zucchini can create a more balanced meal. Opting for whole kernels rather than processed corn products is another step toward reducing its glycemic impact. To further minimize the risks associated with corn, diabetics may consider replacing it with low-carb alternatives like cauliflower rice or zucchini noodles. These options provide the texture and versatility of corn without its glucose-raising drawbacks. While corn can still have a place in a diabetic-friendly diet, understanding its nutritional profile and practicing portion control are essential for maintaining stable blood sugar levels. By making mindful adjustments to how and when corn is consumed, individuals with diabetes can still enjoy its flavor while prioritizing their health. 3. Celery. Celery, often celebrated for its low calorie and carbohydrate content, may appear to be an ideal choice for individuals managing diabetes. Its high water content and natural crunch make it a common ingredient in salads and snacks. However, the way celery is cultivated and transported can introduce significant health risks, especially for people with diabetes who may already have compromised immune systems. One of the main concerns with celery lies in its susceptibility to pesticides and harmful chemicals. Due to its tall growing structure and porous skin, celery readily absorbs pesticides during cultivation. By the time it reaches your kitchen, it may carry high levels of chemical residues. According to studies by the Environmental Working Group EWG, celery consistently ranks among the top vegetables with the highest pesticide residues. This can be particularly problematic for diabetics, as prolonged exposure to these chemicals has been linked to inflammation, disrupted bodily functions, and a higher risk of complications. For diabetics seeking to incorporate celery into their diets, opting for organic celery can be a safer alternative. Organic farming practices minimize the use of synthetic pesticides and other harmful chemicals, reducing potential health risks. Alternatively, washing celery thoroughly or peeling the outer layers can help remove some surface residues, although these methods are not completely foolproof. Another option for diabetics is to substitute celery with other non-starchy vegetables that are less likely to carry high pesticide residues. Spinach, kale, and bell peppers, for instance, offer similar crunch and nutritional benefits while being generally easier to clean and safer to consume. These alternatives provide essential nutrients, including fiber and antioxidants, that can support blood sugar management without the associated risks. While celery remains a low-carb vegetable suitable for many diets, diabetics must approach its consumption with caution. Prioritizing organic options or choosing safer vegetable alternatives can help mitigate the risks associated with pesticide exposure, allowing individuals to enjoy a balanced and health-conscious diet. 4. Green peas. Green peas, often praised for their nutritional value, can pose challenges for individuals managing diabetes. These small, vibrant legumes are packed with vitamins, minerals, and a good dose of plant-based protein. However, their relatively high carbohydrate content makes them a less than ideal choice for diabetics when consumed in large amounts or without careful portion control. A single cup of green peas contains around 21 grams of carbohydrates, a significant amount compared to other non-starchy vegetables. While they do provide beneficial nutrients such as vitamin K, vitamin C, and fiber, their carbohydrate density can contribute to sharp spikes in blood sugar levels if not paired thoughtfully with other foods. For this reason, the American Diabetes Association advises individuals with diabetes to prioritize vegetables with a lower glycemic index (G) and fewer carbohydrates. Despite these concerns, green peas can still fit into a balanced diabetic diet when consumed in moderation and alongside low-carb, nutrient-dense options. For instance, combining a small portion of green peas with non-starchy vegetables like spinach, zucchini, or broccoli can help dilute the overall carbohydrate load while adding variety and flavor to meals. Additionally, green peas can be used as a garnish or in soups and stews rather than as a main ingredient, which can help control portion sizes. Preparation methods also play a crucial role in determining how green peas impact blood sugar levels. Avoid pairing them with high-calorie or high-carb ingredients like rich sauces or mashed potatoes, which can amplify their glycemic impact. Instead, steaming or lightly sauteing them with olive oil and herbs can help maintain their nutritional integrity while reducing their effect on glucose levels. Ultimately, while green peas are not entirely off-limits for diabetics, they do require mindful consumption. Monitoring portion sizes and incorporating them strategically into meals can allow individuals to enjoy their flavor and health benefits without compromising blood sugar control. By balancing green peas with low-carb vegetables and lean proteins, diabetics can make more informed dietary choices that support their overall health and diabetes management goals. 5. Vegetable oils. Vegetable oils, while often marketed as a healthier alternative to saturated fats, can be particularly detrimental for individuals with diabetes, especially those containing trans fats. Trans fats, commonly found in partially hydrogenated oils, are known to exacerbate inflammation and contribute to insulin resistance, making it more difficult to maintain stable blood sugar levels. Research has shown that the regular consumption of trans fats can negatively impact cardiovascular health, a critical concern for diabetics who already face an increased risk of heart disease. Oils derived from soybean and palm, often used in processed foods and for deep frying, are particularly harmful due to their high trans fat content. The inflammatory properties of these fats can worsen diabetes complications, including nerve damage and vascular issues. For diabetics, eliminating or significantly reducing the use of vegetable oils high in trans fats is crucial for better health outcomes. Instead, opting for healthier alternatives can provide nutritional benefits while supporting better blood sugar management. Oils like extra virgin olive oil, avocado oil, and grapeseed oil are rich in monounsaturated fats, which have been shown to improve insulin sensitivity and reduce inflammation. These oils also provide antioxidants and other nutrients that support heart health, making them a superior choice for cooking and meal preparation. Incorporating these healthier oils into daily meals can be as simple as using them in salad dressings, sauteing vegetables, or drizzling over cooked dishes for added flavor. Avoiding deep frying and choosing baking or grilling methods further minimizes the intake of unhealthy fats while retaining the natural flavors of food. While vegetable oils may seem like an innocent ingredient, their impact on diabetes management cannot be understated. By making informed choices and switching to healthier oil options, individuals with diabetes can protect their cardiovascular health and maintain better blood sugar control. Consulting with a healthcare professional or nutritionist can also provide personalized advice on the best fats to include in a diabetes-friendly diet. 6. Leeks. Leeks, while a flavorful addition to many dishes, may not be the best choice for individuals with diabetes. Containing approximately 14 grams of carbohydrates per 100 grams, with only 1.8 grams coming from dietary fiber, leeks present a relatively high net carbohydrate content. This makes them less suitable for those aiming to maintain stable blood sugar levels. In addition to their carbohydrate load, leeks contain fructans, a type of carbohydrate that can ferment in the gut, potentially leading to digestive discomfort such as gas and bloating. For diabetics, this combination of higher carbohydrate content and possible gastrointestinal issues makes leeks a less desirable option, particularly when consumed in larger quantities. Fortunately, there are better alternatives that can provide similar flavor profiles while supporting blood sugar management. Onions and shallots, for instance, not only offer comparable taste enhancements, but also have a more favorable carbohydrate profile. These substitutes are easier to digest for many people and come with added benefits such as anti-inflammatory properties, which can support overall health and diabetes management. To maximize the benefits of leeks or their alternatives, preparation methods are also key. Incorporating them in soups, stews, or stir-fries with plenty of non-starchy vegetables can dilute their carbohydrate impact. Combining them with lean proteins or healthy fats can further mitigate their effect on blood sugar levels. For diabetics looking to diversify their diets without compromising health, understanding the carbohydrate content and impact of foods like leeks is crucial. Opting for alternatives or adjusting portion sizes ensures that meals remain both flavorful and diabetes-friendly, supporting overall health and well-being. 7. Yam. Yams, despite their natural sweetness and nutritional benefits, are a starchy vegetable that individuals with diabetes should approach with caution. A 3/4 cup serving of yam has a glycemic load of approximately 9.3, which can significantly impact blood sugar levels. Their high carbohydrate content makes them prone to causing blood glucose spikes, particularly when consumed in larger portions or without accompanying low glycemic foods. The simple carbohydrates present in yams are rapidly absorbed by the body, leading to swift fluctuations in blood sugar levels. This can result in a roller coaster effect, causing energy dips, mood swings, and increased hunger shortly after consumption. These effects can make it more challenging for individuals with diabetes to manage their blood sugar effectively and maintain consistent energy throughout the day. For those seeking alternatives, gooseberries offer a diabetes-friendly option. With a low glycemic index and carbohydrate content, gooseberries help stabilize blood sugar levels while providing a good dose of antioxidants and essential vitamins. Their tangy flavor makes them a versatile addition to meals, from salads to smoothies, offering both health benefits and a refreshing taste. Incorporating yams into a diabetes-friendly diet is still possible, but moderation and strategic pairing are key. When consuming yams, combining them with high-fiber vegetables, lean proteins, or healthy fats can help slow down the absorption of their sugars, mitigating potential spikes in blood glucose. Additionally, opting for cooking methods like steaming or roasting without added sugars or fats can further support blood sugar management. Understanding the glycemic impact of foods like yams and finding creative alternatives or preparation methods empowers diabetics to enjoy a varied diet without compromising their health. By prioritizing low glycemic, nutrient-dense options, individuals can take proactive steps toward better blood sugar control and overall well-being. Parsnips, often celebrated for their sweet and earthy flavor, are another vegetable that individuals with diabetes should approach cautiously. Despite their appealing taste and versatility, parsnips are high in carbohydrates, with a single small cup containing approximately 24 grams of carbohydrates, including 6 grams of sugar. This carbohydrate load can lead to rapid spikes in blood glucose levels, which pose significant risks for individuals managing diabetes. Frequent consumption of high-carb foods like parsnips can contribute to insulin resistance over time, making it increasingly difficult for diabetics to regulate their blood sugar levels effectively. Additionally, these spikes in glucose can elevate the risk of long-term complications such as cardiovascular disease, nerve damage, and kidney issues. For those looking for alternatives, nutrient-dense vegetables like spinach serve as excellent substitutes. Spinach is low in carbohydrates and high in essential vitamins, minerals, and antioxidants, making it a diabetes-friendly option. It also supports overall health and improves insulin sensitivity, helping to keep blood sugar levels stable. To enjoy parsnips without significantly impacting blood sugar levels, consider consuming them in smaller portions and combining them with low glycemic vegetables and proteins. For instance, pairing a small serving of roasted parsnips with a leafy green salad and grilled chicken can create a balanced meal that minimizes blood sugar fluctuations. By being mindful of portion sizes and incorporating healthier alternatives, individuals with diabetes can enjoy a varied diet while maintaining better control over their blood sugar levels. Making informed food choices, like replacing high-carb options with low glycemic vegetables, is a crucial step toward long-term diabetes management and overall health. 9. Broad beans. Broad beans, also known as fava beans, are a rich source of plant-based protein, fiber, and essential nutrients. However, for individuals managing diabetes, these beans come with some concerns. Broad beans have a high carbohydrate content, with a single cup containing approximately 12 grams of sugar and around 30 grams of total carbohydrates. This combination can significantly impact blood glucose levels, especially when consumed in large quantities. The sugar content in broad beans, while natural, can lead to rapid spikes in blood sugar levels. Moreover, their calorie density around 111 calories per cup can contribute to weight gain if not consumed in moderation. Weight gain is an additional risk factor for diabetes, as it can complicate blood sugar control and heighten the risk of insulin resistance. Regular consumption of broad beans can also increase the likelihood of long-term health issues such as cardiovascular disease and metabolic syndrome due to their impact on blood sugar levels. For those managing diabetes, it's essential to be mindful of how often and in what quantities these beans are consumed. A healthier alternative for diabetics is green beans, which are lower in carbohydrates and calories while still providing essential nutrients. Green beans are also rich in fiber, which supports better blood sugar regulation. They are versatile and can be included in a variety of dishes, from stir-fries to salads. To enjoy broad beans occasionally without causing significant blood sugar fluctuations, consider pairing them with low-carb, high-fiber vegetables like spinach or kale. For example, a small serving of broad beans can be added to a vegetable stir-fry or mixed into a leafy green salad with a light dressing. Ultimately, the key to including broad beans in a diabetes-friendly diet lies in portion control and thoughtful pairing with low-glycemic foods. By taking these steps, individuals can enjoy the flavor and nutrition of broad beans while maintaining better control over their blood sugar levels. 10. Sweet potatoes. Sweet potatoes are often regarded as a nutrient-rich alternative to regular potatoes, celebrated for their rich beta-carotene content, fiber, and various health benefits. However, for diabetics, sweet potatoes can pose challenges due to their carbohydrate content and glycemic impact. Despite having a lower glycemic index G compared to white potatoes, the glycemic load GL of sweet potatoes remains moderate to high. This means that consuming them can still lead to significant blood sugar spikes, especially when eaten in large quantities. A medium-sized sweet potato contains approximately 23 grams of carbohydrates, making portion control essential for those managing diabetes. The orange variety of sweet potatoes, which is the most common, tends to have a higher glycemic index compared to other types like purple sweet potatoes. This higher G means that the sugars in orange sweet potatoes are absorbed more quickly into the bloodstream, potentially causing rapid increases in glucose levels. Preparation methods also play a crucial role in determining the impact of sweet potatoes on blood sugar. For instance, baking or roasting sweet potatoes tends to concentrate their natural sugars, making them more glycemic than when boiled. Frying them, such as in sweet potato fries, adds unhealthy fats and further elevates their glycemic load, making them a less suitable option for diabetics. To enjoy sweet potatoes without drastically affecting blood sugar, it is essential to practice portion control and pair them with low glycemic foods. For example, combining a small serving of boiled or steamed sweet potatoes with a lean protein source, such as grilled chicken or tofu, and plenty of non-starchy vegetables can help moderate their blood sugar impact. Another option is to choose purple sweet potatoes, which have a lower glycemic index and higher antioxidant content. For those seeking alternatives, avocado makes an excellent substitute. Avocado is low in carbohydrates and high in healthy fats, making it a diabetes-friendly option. Its rich fiber content can improve insulin sensitivity and support overall blood sugar regulation, while adding a creamy texture and flavor to meals. In conclusion, while sweet potatoes can offer nutritional benefits, their potential to cause blood sugar spikes requires careful management. By controlling portions, choosing healthier preparation methods, and pairing them with complementary foods, diabetics can enjoy sweet potatoes occasionally as part of a balanced diet. Consulting a healthcare provider or dietitian for personalized advice can further support effective diabetes management. Conclusion and key takeaways. Managing diabetes effectively requires a keen understanding of how different foods, including vegetables, impact blood sugar levels. While vegetables are often heralded as the cornerstone of a healthy diet, not all of them are ideal for individuals with diabetes. High-carbohydrate vegetables like sweet potatoes, corn, and peas can cause significant blood sugar spikes if consumed in large quantities or prepared improperly. Similarly, certain cooking methods and added ingredients, such as frying or high-fat sauces, can amplify the glycemic impact of otherwise safe vegetables like zucchini or bell peppers. The key to incorporating vegetables into a diabetes-friendly diet lies in careful selection, preparation, and portion control. Opting for low-glycemic, non-starchy vegetables like spinach, kale, and broccoli can help maintain stable blood sugar levels. Additionally, pairing higher-carb vegetables with protein, healthy fats, and other low-carb foods can mitigate their effects. Substitutes like avocados, leafy greens, and whole grains provide nutrient-dense alternatives that support overall health while minimizing glucose spikes. Understanding which vegetables to limit or avoid empowers individuals to make informed dietary decisions. Incorporating healthy habits such as reading nutritional labels, choosing organic options when possible, and consulting with healthcare professionals ensures a balanced and effective diabetes management plan. Remember, moderation and mindful eating are crucial. Even high-carb vegetables can occasionally fit into a well-planned diet when paired with the right foods. By prioritizing low-glycemic, nutrient-dense choices and avoiding common pitfalls, diabetics can enjoy a diverse and flavorful diet while keeping blood sugar levels in check. These strategies not only support diabetes management, but also promote overall well-being, making every meal a step toward better health.